Welcome to today's IRP seminar. I am very pleased to introduce Taryn Morrissey. Taryn is the chair of the Department of Public Policy. I said that in the right order. In the School of Public Affairs at American University, and has extensive experience also working in the government, in the federal government, in HHS, and also on some fascinating Senate committees. So brings a wealth of expertise in various sectors and does research on early care and education, as well as paid family leave, and I'm going to be sharing some of that today. So I'm going to turn things over to Ken. Oh, and has asked that we ask clarifying questions, hold substantive questions. Yeah.
Thank you. Thank you so much for inviting me here. The IRP is a really special place. I'm trying to do that. I don't blame you if you look out the window instead of listening to me. It's really beautiful. So thank you. Today I'll be talking about a specific research paper that is in progress. And so it's a really great time to get feedback. So I welcome all of it. Today's paper is The Glass is Half Full, the safety net for low-income women surrounding childbirth. And this is joint work with Colleen Heflin and Hoi-Jung Kim at Syracuse University. She's a fantastic graduate student. I'll just there too. First, acknowledgements. We use administrative data from Virginia, and we thank the Department of Social Services and the Virginia Employment Commission, as well as these opinions are the authors and do not represent the views of the Virginia Department of Social Services or the Virginia. So I'm a developmental psychologist, and I really am driven by an interest in how the childhood period and experiences during the early childhood period shape life trajectories. The early childhood period in particular is sensitive to inputs. Brain development is extremely rapid, especially the first year. And we know that household resources during the first year of development and the stability in those resources is really important for lifelong trajectories. And I know there's many people in the room who are studying those specific questions. We also know that the perinatal period is particularly important for women's health as well. And in the US, we have high rates of maternal mortality, which means a death within the first 12 months following birth. And we have really stark racial and ethnic disparities in maternal mortality. And importantly, these trends are going in the wrong direction. We're seeing increase over time. This chart from the CDC shows 2018 through 2021. And we know that time to recover from childbirth and access to healthcare during pregnancy and after are very important. Yet the time of surrounding childbirth is often one of economic insecurity and economic instability. This figure is from Alex Stains's work in 2020. It uses nationally representative data from the SIP to chart how family income or household income changes in the year before and the year after childbirth. You can see that in various measures of income, whether it's income to needs, which mechanically changes when you add a baby after birth, but even gross income changes, decreases, right, and is lowest right around the time of childbirth. That middle line is childbirth. This is particularly important because, as anybody knows, whether you're a parent or not, that babies are very expensive. They come with a host of new expenses, including childcare, diapers, including potentially increased housing expenditures. So basically, parents must do more with less. So what happens? Many families, many women turn to partners who are earning, and many partners end up stepping up their work hours to try to increase resources. Others turn to other members of social networks or to savings. But those without those kinds of resources may rely on paid family leave. So as many of us know, in this country, we lack a federal paid family leave program, and most states don't have a public paid family leave program. So then women turn to the safety net, which was designed to smooth economic resources during temporary periods of economic strain, which includes childbirth. So women are most likely to begin participating in TANF and SNAP child. As I mentioned, I think it's only fewer than 1/4 of civilian workers in 2021 had employers who voluntarily provided paid family leave. I mentioned too that this was in the middle of a global pandemic. We have the Family and Medical Leave Act, which was passed in 1993. This provides job-protected unpaid leave of up to 12 weeks. Unpaid leave is often economically not viable to many families, low wage or not, but also low wage workers are less likely to be eligible for FMLA because there are certain job tenure and hours requirements as well. So many women end up taking brief leaves. And unfortunately, this is associated with a host of health problems, including infant health, poor maternal, mental, and physical health and stress. So what are these times, or how long do women take out of the workforce before they return to childbirth? This is a study by Han et al. In 2008 that used nationally representative data of births born or individuals born in 2001. So this was before any state had paid family leave, 23 years ago. You can see on the left figure that about 60% of women are back to work at 9 months when their infants are 9 months of age. But on the right, there are racial and ethnic differences to the return to work, with Black women returning to work, more Black women having returned to work by 9 months of age. And in general, about 40% of women have returned to work by about 3 months, 60% by 9 months. But this is among all mothers who had infants, right? What about low-income women? And really, how do low-income women, who are the most vulnerable in terms of less likely to have access to employer-paid family leave, less likely to be eligible for the protections under FMLA, how do they make ends meet, and what are their labor force participation patterns around the birth of a child? Among those who participate in the safety net, how does it make up for lost earnings? In particular, given our existing safety net, what's the best possible scenario for resources in a household during the period surrounding childbirth? So TANF, not SNAP. TANF, SNAP, and the Earned Income Tax Credit and the Child Tax Credit are among the largest social safety net programs in the US, aside from Medicaid, which provides public health insurance, but is not a cash or cash-like program. So TANF is cash welfare, is a temporary assistance to needy families program. SNAP is a supplemental nutrition assistance program, formerly known as food stamps. And then the tax credits are shown here. This is data from the Brookings Institution that estimated or simulated what a single parent household would receive in terms of benefits from, I believe it's like 2001 or 2000, it started up through 2022. This orange slice represents SNAP. Those are cash-like vouchers that families can use to buy foods to be prepared at home. SNAP constitutes a large percentage of what low-income families would receive. That gray is the child tax credit. It spiked during the pandemic when it was refundable and drastically expanded and reverted in 2020. That very light blue is state earned income tax credit, and the slightly darker blue is the earned income tax credit at the federal level. And then the dark blue is TANF or cash welfare. So these, as well as WIC, which is the Nutrition Assistance Program for Women, Infant, and Children, is what we focus on today. This is what pregnant women and new mothers would be eligible for, low income. And specifically, we use data from the state of Virginia. TANF in Virginia is relatively restrictive in terms of eligibility and offers pretty low benefits. But it is the cash welfare program for low-income families. The maximum benefit for a mother with 2 children was about $363 to $444 $2 a month in 2018, so this is not very much. Virginia varies eligibility as well as benefit levels by region. We have Northern Virginia, which is very, very expensive near the DC area, and then Southwest Virginia, which is more rural and generally less expensive. So that table below shows the income eligibility thresholds for receiving TANF. You have to have really low income essentially to participate in TANF. So it's not if a new mom or a pregnant mother were to receive it, they would have to be in a very poor financial state in general. There's a lifetime cap of 60 months in Virginia. And work requirements unless you're in the last stage of last trimester of pregnancy or you have an infant under 12 months. The earned income tax credit and the child tax credit are refundable tax credits for low to moderate income workers. These benefits are much higher, but they're received as lump sums once a year, right around tax time, whereas TANF is a monthly benefit. There is a state earned income tax credit that's about 20% of the federal EITC. This was until 2022, this was not refundable. So in the period we're looking at, meaning that it doesn't help families very much who don't have a tax liability. The child tax credit is slightly smaller benefits, or smaller benefits, but still important and goes higher up the income scale. And then again, both of these credits are received monthly as like smoothed income, but as a lump sum. So this figure shows household income on the x-axis and the EITC refund size on the y-axis. Importantly, the EITC and CTC are only received by people who have earnings. So if you have zero earnings, you get zero benefits for EITC and CTC. The EITC is designed to not have a cliff, so the refund increases as earnings increase, but then without, you don't have to apply for the EITC or the CTC, you just have to file your taxes, which reduces stigma. You don't have to go to a social welfare office or fill out another form, but it's still not 100% take up. It's about 8 in 10 eligible households receive the earned income tax credit. And now that will end up being important to this study. I'll come back to that. And then these figures show the child tax credit, the benefit size, as well as going up the income spectrum. The 2017 Tax Cuts and Jobs Act increased the size and the eligibility for the child tax credit. But again, if your earnings are zero, you get zero. Those are programs that are considered public assistance or provide cash programs to low-income families. We also look at 2 nutrition assistance programs. The SNAP program is more standard across the country, but is administered by states, including Virginia. In 2018, the maximum benefit size for SNAP was about $500 for a family of 3. Again, these are cash-like vouchers to purchase food to be prepared at home. They cannot be used to purchase diapers or toothpaste or rent. It's really for foods to be prepared at home. They're not fungible in the same way that a tax credit is. Income eligibility is set at 130% of the federal poverty line, no categorical eligibility in Virginia. There's no time limit or work requirement if there are children in the household. And it reached about 10% of the population in Virginia in 2022. So it's much larger than about the 20,000 individuals who participated in TANF. And among pregnant women and women with young children, they're eligible for WIC, which is the Special Nutrition Assistance Program for women, infants, and children. This is again a nutrition assistance program, but it's much more prescriptive than SNAP in terms of being limited to foods that are geared toward a child's developmental stage or a pregnant woman's nutritional needs. And the benefits then vary. The benefit levels vary with the age of the child. The highest benefit is for infants, especially formula-fed infants. formula is very, very expensive. And about 88% of infants on receiving WIC in Virginia are on the formula benefit. Income eligibility is higher than SNAP. So if you meet the, if you're a pregnant woman or you have an infant and you're receiving SNAP, you are eligible for WIC. That doesn't necessarily mean you receive WIC, but you are eligible. And it reached about 28,000 infants and 9,000 postpartum mothers in 2022 in Virginia. SNAP's participation rate among households with children is pretty high. Nearly all households with children that are eligible for SNAP participate. That's not really true for WIC. These are national estimates in Virginia, but about 78% of households with infants who are eligible for WIC participate. You can see participation levels really decrease as a child ages. This is for numerous reasons, but including benefit decreases, and often families are required to recertify and visit in person. Although for the period we're looking at, again, is that red circle, it's about 78%. So similar to the EITC participation rate. So our specific research questions are, in this study, are how much do household earnings decline in the year of birth among a sample of low-income women who qualify for TANF and SNAP relative to the year prior to birth? So we're looking at earnings before birth compared to earnings in the year after. 2, how soon after the birth of a child do women participating in TANF and SNAP re-enter the labor market? So again, these are women attached to the safety net. And 3, to what extent do the benefits from cash support, the TANF, EITC, CTC, and food support, SNAP and WIC, offset the loss of prior earnings? We use data from Virginia, 2 sources of administrative data in this study. First, from the Department of Social Services from 2016 to 2020, we have demographic information, including sex, race, ethnicity, age. Monthly participation in TANF and SNAP are observed. County of residence, which again is important to benefit levels and eligibility for TANF, as well as cost of living. And we link adults in households with births to wage records from the Virginia Employment Commission. This is unemployment insurance from 2016 to 2021, to look at earnings for all jobs in covered employment. So in UI covered employment, for all adults in the household, we're able to link individuals at the same residence. And we focus on total earnings. We lack hours, unfortunately. And because we're using UI records, we lack information on informal employment, the gig economy, et cetera. So those are important caveats to keep in mind. Our administrative data have a number of strengths, but I know many people in the room have used administrative data and are well aware that there's a number of limitations as well. What we observe in our data are labor force participation. We have quarterly data on jobs and earnings for all household members. Again, we don't have hours or weeks worked, unfortunately. We also observe TANF and SNAP participation, which also comes with a household roster. And so that's where we get those demographic information variables. That's also where we get new births. What we don't have, or what we impute, are SNAP benefit levels based on household size and household earnings. We impute TANF benefit levels. Again, we observe participation, but not the benefits received. We impute them based on household size and county of residence. And then we use, following other work like Alex Staines's work I mentioned previously, we estimate EITC and CTC refunds using TaxSim. We include both the federal and the Virginia state. Importantly, this assumes 100% participation among our sample. Again, we're looking at the best possible scenario of what our safety net might provide, where we know participation is really just about 78%. And then for WIC, we also impute participation and benefits levels, again, assuming that 100% participation. We use the formula benefit levels for infants as well.
Taryn.
Yeah.
Do you know anything about child support or non-resident?
No, that's one of the limitations. We do not observe child support. We do have Medicaid coverage data. We don't claims data, but we know that 95% of births were covered by Medicaid. So the vast majority of the sample was receiving Medicaid too. We focus on individuals identified as female, aged 19 to 44, who gave birth between July 2017 and December 2019, who were somehow attached to TANF or SNAP. So they participated in one of those programs or both within 12 months of childbirth. And that's what we have their demographic information. So this is about 42,445 individuals. As a reference period, there's about 95,000 births in Virginia each year. So this represents about 17% of births occurring in the state across that 2.5-year period. Yeah.
December 2019.
Yeah.
We're running to work in the middle of COVID.
So we're running sensitivity analyses where we eliminate the last year, because low wage workers were particularly affected.
And then the EIPs come in.
Yes, that's right. That's right. Yeah. We cut off our analyses at December of 2020 in these results regardless. So we don't observe the expanded CTC. Yeah.
The CTC expansion, does that affect all the women in your sample or just some of them?
We don't, we cut off our data period at December of 2020 here as well. So we don't.
I meant the Tax Cuts and Jobs Act.
Oh, sorry. The 2017. Yes. So that expanded the CTC, that would affect everybody. That's right. Yeah. But it would be lower before, what was it, January or they received their tax, February 2019. So those with earnings qualify for the earned income tax credit and the child tax credit with the timing of receipt post-birth depending on the month of birth. So in other words, if you have a baby in December, you get the child tax credit just a few months later when that infant is 3 months old. If you have a baby in January, wait over a year to get that tax refund. So we assign the tax benefits to the first quarter of the year. And so you'll see it's kind of on average, it smooths over those cash benefits, but at the individual household level, it's not smooth. It's received at one point in time. From this, we have two subsamples, a worker sample, and those are women who worked at least one of the 4 quarters prior to childbirth. That's the majority of our sample. And then a new entrant sample who are not receiving SNAP or TANF in the 6 months prior to childbirth. I won't show too much of the new entrant sample results, but I have slides on them and I'm happy to talk about them. This is our example. Graphically, you can see there's a lot of overlap between single mother and worker. New entrants are likely to be workers. Importantly, shows it better, about 66% of the women in our sample are single parents. For the 1/3 that are not single parents and have another adult in the household, we can link those earnings and we can do. Our sample is on average about 27 years of age. They are quite racially and ethnically diverse, and about 30% are having their first child. Others, or the majority, have another child in the household already. You can see that new entrants are much more likely to be having their first child when they enter SNAP or TANF. So turning to the results, this figure shows women's employment in the year prior to birth for our full sample. Nearly 3/4 of women were working at least 1 quarter in the year prior to giving birth. And rates are particularly high among non-Hispanic Black women. This is really similar to national estimates. It's about 70% of pregnant women are employed, and about 74% of non-Hispanic Black pregnant women are employed. So when do they go back to work? Most women in our sample, about 2/3 of the full sample, and about 80% of those who worked prior to birth, so 80% of this 73%, are back to work within 1 year of giving birth. On average, women return to work about 2.2 quarters, which is about a little more than 6 months after giving birth. But there's pretty stark racial and ethnic differences. You can see non-Hispanic Black women are back to work much sooner than their peers, and non-Hispanic white women and women of Asian descent are take longer periods away from the labor force on average. This table shows women's annual earnings prior to, in the year prior to, and the year after childbirth. In general, they're just very low. It's really hard to imagine supporting a family on these earnings, especially in a place like Northern Virginia. In general, these women are low-wage workers, and they experience on average about a 15% decline in earnings from the year before to the year after birth. And again, they have a new individual to take care of. Asian and non-Hispanic white women experience the largest decreases on average in earnings, but they also are tending to earn slightly more, particularly than non-Hispanic Black women on average. Those average decreases, though, mask some pretty substantial income instability from year to year. It's about more than 4 in 10 women experience a 30% or higher decline in earnings from the year prior to childbirth to the year after childbirth.
If I start from a really low base, a 30% decline is not that big. Like, can you help me think about what the dollars are here?
Yeah, I mean, it's a great point. And there are some women who have zero earnings, right? So how to think about that, like whether it's the magnitude of decline in dollar amounts or percentage wise, I think there's multiple ways to think about that, right? There's relative poverty or there's change. And I think it varies, by racial and ethnic group as well. Yeah, I was talking with about income instability during childbirth at one of my meetings this morning, and I think it's a really rich area for a study because the uncertainty, I mean, whether this is predicted or not, we don't know either. If you're fired while you're pregnant, that's a different scenario than if you choose to cut down your work hours.
Was this just the women's earnings or all earnings in the household?
These are all household earnings.
Oh, all household earnings. Okay.
And again, it's about 2/3 are single women, but yes, but it's all earnings. So in general, there are households where the partner is picking up the slack in terms of decreased earnings, but on average, there's a lot. This shows that table somewhat graphically, and particularly how public benefits make up for these lost earnings, right, or don't. In short, public benefits do offset lost earnings, more than offset, actually, but with caveats. So this orange dotted line are total household earnings, and you can see they begin to decrease around the third quarter prior to birth. This is right around the beginning of pregnancy, and tend to, on average, decrease to be at their lowest right around when most women are not receiving any sort of paid leave benefits. And then they tick up again in the quarters following childbirth. Earnings do not approach what they were, though, 1 year prior to childbirth on average. The dark blue dotted line represent public benefits. And again, they increase as women are during pregnancy, and then they're at their highest level just following childbirth, but then slowly tick down This gray line in the middle represents total household resources. So if you add earnings and you add public benefits, what is the income, the total resources available at quarterly level to women and their households? You can see it's actually higher than prior to childbirth. Sorry about that. This is those figures annualized and by race. So the gray bars represent pre-birth earnings in the year before birth. The orange are earnings in the year after birth. And then that blue represent total public benefits. So the net increase in benefits. For every racial and ethnic category we studied, we see that if you're looking at the totality, again, of what's the best possible scenario of what the existing safety net can provide you, your total resources are higher post-birth than after birth. Again, you have more expenses, and these levels are still not high when you look at the total amount of money, but it does appear that our safety net, the best possible scenario, is offsetting those earnings and allowing women to take an average of about 6 months away from the labor market. So this is a good story, right? If we dig a little deeper in terms of the types of benefits families receive, we see more nuance. This is that figure I just showed you, but separated out by different types of benefits. So here, that the darkest blue are WIC benefits. They increase during pregnancy and are largely maintained across the first year of birth. The royal blue is SNAP benefits. Those constitute the largest slice of benefits available to pregnant women and women in the year after birth. And the lighter blue are tax credits and TANF. I mean, TANF is actually really hard to see in this figure because it's such a small slice, right? The lightest blue tax credits, again, this looks like it's somewhat smooth across quarters, but at the household level, this is received in a given month in a year. So usually February or March at tax time, but it's averaged across individuals in their samples. So it occurs during different quarters following birth. Yeah. Birth it's any birth. So yeah, we control for household size, but this is subsequent births as well.
Some of these people might be benefits.
That's right. Yes, that's right. Or their earned income tax credit refund could be higher because of an addition to the.
So you control, did you do an equivalent scale adjustment?
We didn't, and we are going to do a subsample looking at just first birth. Yeah. I think I think there is rationale to think
there's resources and needs, and that's one way of getting at it. If you divide by some equivalent scale.
Yeah, you mean like economies of scale? If you have, yeah, that's true. Yeah.
I mean, needs go up, but
not as much.
First baby, a lot, particularly with a single mother. But then after that,
yeah, that's a great point. Childcare too could be just a marginal.
That's hiding there somewhere. Childcare. These people aren't buying childcare through any marketplace.
I mean, yeah, earning $15,000 a year wouldn't be enough to buy one kid childcare at a center.
But you don't have vouchers, don't have the CCDFs or any of that for. Okay.
We do have childcare data, but we don't use it in the study yet. We've thought about how to a subsequent study looking at childcare subsidies, seeing are they allowing mothers to go back to work sooner.
You'd have to, with the return to work with the little childcare, there's got to be some family help somewhere in here.
Yeah. A lot of it. Yeah. These women might not be relying on social networks for financial resources, or they may, but they not to be relying on social networks for. Here I want to point out, so in addition to the tax credits being somewhat unstable income, you can imagine it's like an income shock during tax time and might not be predictable. sometimes people don't know necessarily what they're going to get at tax time. The majority of benefits received at a core level are food. And food is obviously extremely important, right? And necessary for health and life, but it's by no means the only thing that people have to pay for, whether it's rent, whether it's a bus ticket, whether it's healthcare co-pays, whether it's childcare. And our safety net right now is doing that. Our safety net largely is doing well for food assistance. Cash is very unpredictable or at very low levels. And here you can see the dollar amounts in terms of earnings changes, as well as benefits. You can see that the benefits for SNAP and WIC are in the $300 to $700 per month range each, so much higher than the $200 to $600 combined TANF and tax credit average per month. And importantly, I'll just note too, we know that resources during the prenatal period and stress during the prenatal period is very important for maternal and infant health and long-term outcomes potentially as well. But we see that the total household resources during pregnancy are lower than 12 months before birth on average, even when you take into account the benefits, the best possible scenario of benefits in our social safety net. I also want to point out, again, this is a best case scenario in our existing safety net. The periwinkle, I guess, color is the simulated benefits, the benefits levels we assume, given 100% participation in WIC and tax credits. And what we observe are the lighter blue. So we know that these women are participating in TANF and SNAP, which we know, and when they are participating. We don't know about the tax credits and WIC. And so there's a lot of room for, these women are on average somewhere between that high point, that dotted line, and where the periwinkle color starts.
Yeah. Am I reading that right, that even in the extremely conservative assumption that no one claims EITC and CTC, resources increase following childbirth?
No, yeah, I can see how the impression, this line would be lower then. It's this gray line is following, is this minus the, it's earnings plus total benefits. And so total household resources would be lower then.
No, but it's positive.
No, this is what the total benefits assume. So it would be imputed minus observed, and it would probably be around here. I don't have that number. It's not the best graphically for showing that question. That's a good question.
It's nice that you can, have the optimistic and pessimistic bounds.
Right. That's a fair way to categorize it. Yeah. So in summary, we find that household earnings decrease before childbirth. And during pregnancy in particular, there's very, very little cash support. And all the increased resources come from WIC and SNAP benefits. Post-birth, cash resources increase to about 32% of total benefits. So meaning that the rest are all food assistance. And that's in the first quarter after birth. After that, it's about 21 to 25%. So only 1/5 to 1/4 of benefits are in the form of cash and fungible cash. And food support is much higher than cash support in every quarter. For new entrants to the safety net, cash benefits are much higher. And this is because their earnings were much higher in the year before, and the earned income tax credit and CTC are based on prior year's earnings. Still though, it's only about 32 to 43% of total benefits.
Can you explain why the EITC and CTC fade out over time? Do you have information for that?
I think
the other way.
I know. I asked our co-author who's crunching the numbers. I think it's a artifact of when children are born.
That's what I was wondering. The seasonality thing.
Yeah.
So it's not that the program becomes less generous.
That's right. Yeah. Sure. And so we call this paper the glass is half full because together post-birth earnings and maximum public benefits offset each other. So from the major safety net programs, SNAP, EITC, TANF, CTC, and WIC, together they're offset that loss in earnings. And that's, again, not counting child support, that's not counting the value of Medicaid as well. They help women, provide them with the resources to allow them to stay an average of about 6 months out of the labor force, which may support infants' health and mothers' health. There's real variation between racial and ethnic groups in this. And so that begs the question of equity and long-term outcomes as well. Public benefits do not seem to be a working disincentive to those who are worried about that. There's, again, about 80% of women are back at work 4 quarters before post-birth. Tax credits, WIC, and SNAP play vital roles, TANF less so. And I certainly don't think of tax credits, WIC, and SNAP as parental leave programs necessarily, but it turns out they're serving really, really important roles. But the glass is half empty because together household resources are still really, really low during a time of high expense and of real developmental importance to mothers and their infants. And the majority of public benefits are across the entire 2-year period we look at are from nutrition assistance programs, which are not fungible and can't buy the range of expenses that are needed. Most of the cash benefits, too, about 92%, are from tax credits distributed in lump sums at tax time. So TANF is important, certainly, to certain households, but on the aggregate, it's really a drop in the bucket in terms of providing support for low-income mothers or low-income women for having births, not just new mothers. And these tax credits create income instability, may be unpredictable, and is really dependent on when your child is born. December versus January is a big difference in resources. And there's other work. I know Dave Marquette in my department is doing work on showing there's health effects of the timing of those births as well. So again, we estimated the total maximum benefits possible in the existing system in Virginia. We know that WIC and tax credit participation is about 80%, not 100%. So this is a best case scenario. We also know that there's disparities in participation in these benefits as well. Hispanic families, those with any immigrant members are less likely to receive EITC, for example. So these are really overestimating benefits, more so for certain groups of individuals. I would say these results suggest that women need more cash and flexible benefits to pay for the range of expenses surrounding the birth of a child. Paid family medical leave usually isn't considered a safety net program per se, but it can serve a really valuable role in helping particularly low income and low wage mothers make ends meet around the birth of a child. Public programs in particular are important for low wage workers because they're less likely to have employer supported care, and it does expand equity in leave taking. Research has shown that, as well as improves maternal and child health. We have about 14 states and DC have passed paid family and medical leave laws. Virginia did so as well. Last year, a bill passed the Senate and the House, and it was vetoed by the governor in April of 2024. So this is a really timely, really an issue, particularly as we might have more women carrying infants to term as well, carrying pregnancies to term. Here, we also have the expiration of the Farm Bill this coming month in just 11 days. The House Ag Committee proposed about a $30 billion cut to SNAP, which would affect low-income families broadly, but given its importance during that really sensitive, critical period for development and pregnancy, as well as the year after birth, low-income women surrounding childbirth are affected. So our findings have implications for future research too. We research should really consider the package of benefits available and the timing of benefits received across a range of social programs when studying the effects on families. It's really hard to come up with causal identification strategies to do so. I'm quite sympathetic to that, and I just presented a descriptive study. But I think how these programs interact, particularly how these safety net programs interact with paid family and medical leave. And I know there's work by Morrissey and others who have looked at how TANF participation has decreased with paid family and medical leave laws. And so I think those kinds of research questions are really important to policymakers and in predicting how these programs will operate in the future as well. We also, I think it's taking a step back. I think it's this kind of best case scenario is a nice thought experiment in thinking through 100% participation rate in the safety net. I mean, if we were able to get families to receive what they're eligible for under existing law, we could cut the child poverty rate, some estimates from 15% to 8.5%. And I think we could certainly, it seems that we could improve there's room for growth in terms of getting pregnant women and women with infants involved or enrolled in programs which they're eligible for. So in conclusion, the majority of women who enter SNAP and TANF are connected to the labor market prior to birth and return to the labor market within 6 months. Household earnings decrease around childbirth and do not recover 1 year after birth. And this is similar, again, to nationally representative data by Alex Stanzik and others, but this is true using administrative data in our state as well. Assuming this total maximum public benefits available, this earnings loss is offset, but total resources are low, and much of it is food support. Tax credits are vital in terms of household resources, but do not provide stable support. And again, we provide an overestimate of household resources. So further public investments that provide regular, flexible, like cash benefits are really needed to support low-income families around childbirth. So I welcome questions and feedback. Tim.
Oh, Taryn, this is great. Let's fill the glass more. First thing you do is you send your paper to somebody who knows what they're doing in the Harris campaign and say, this is the reason why for $4,000 baby bonus makes some very important sense, right?
Connect.
And you get a hold of somebody who used to work for Romney. Romney wanted to start the refundable child tax credit in the 3rd trimester. In other words, to start it presumptively before birth.
Didn't realize
it was a monthly child. That's the other thing you could obviously simulate. It's a monthly child tax credit. But I mean, this is prime made for Harris's $4,000 baby bonus. My God, this is you're doing so much simulation anyway. Just plop that in there and fill the glass, overflow. And that's not going to, you're going to have income effects, but not substitution effects going back to work, because it'll continue up over any reasonable range of earnings. And but it would be monthly, so it will continue. And you could still get the EITC in a lump, which provides some advantages. You can make inframarginal moves, rent, fix the car, or whatever. But I think very interesting. The current safety net's got some tatters and holes. But realize also you're never going to get 100% of the CTC because of family instability. And you look back, the Census Bureau, finds that they simulated the 2021 benefit and spent the amount of money that the Fed said you're supposed to spend on child tax credit. Then they matched it to the tax records for 2021, 22, and find out they had given the benefit to 13% of the families who didn't really get it. And the underlying thing is that something changed. Family arrangements changed, support changed, whatever. And that's a problem of running. If the family's stable, the tax system is wonderful for flapping things out. But when there's instability in families like this, low income, maybe a partner, maybe not a partner, to take up is really hard unless you got somebody like Social Security, someplace you can go and claim, I'm supporting the child lives with me, and so forth. So. But still, those are, you know, I think the Harris baby bonus $4,000 is made for this situation.
Yeah, that's a great idea.
So this is really exciting. Really appreciate you sharing this research. I was struck by the big decline during pregnancy, and I think in total resources, and I think that's consistent with some of the research we've been doing that shows really employment declines a lot for less educated women during pregnancy, especially relative to college educated women. But one thing that I've been thinking about is like what I don't think we know very much about what these women are doing to make ends meet, and I'm particularly curious about like living arrangements and things like doubling up or moving in with, you know, family members or partners, and how I'm wondering if you can observe anything about changes in living arrangements throughout this period that might shed light on like what maybe is going on.
It's a great idea. We probably could. It would require another data poll because we have the link data, but we don't observe the addresses, so we don't have like the linking variable. But we know all household members' covered earnings. We don't know. I guess we could try to. We wouldn't know if somebody dropped out of the labor force or moved in our current data, right? If somebody went from having earnings to not having earnings, a partner, we wouldn't know if they left or if they just had it. But we could potentially work with the amazing people in Virginia who put the data together for us to use to get at that, because that's a great question.
Would you know if someone like, you know, during 2 quarters before childbirth, if someone moved in with somebody else? Probably not. No. Yeah. I'm curious if there's anything going on there.
Yeah, and we don't observe household, well, no, we have a household roster, but that is at the time of TANF or SNAP receipt, and so it's like a point in time. Yeah, so we don't know if they're moving in and out of like their mother's house who doesn't have covered earnings, right? We don't necessarily observe them change. But yeah, that would be really, really interesting. I mean, it's important to mention too, because yeah, I don't know how these women make us work. I can't imagine.
Yeah. I'm wondering your sample selection. If you don't select on SNAP, because I mean TANF, everyone's receiving, TANF is also receiving SNAP, but if you just look at low income workers or people with low incomes, would your results change? Because there's a lot of people probably in Virginia who have real or perceived inability to access SNAP. And so that might change yours, because I think you're really focused on like total resources, regardless of whether they were receiving SNAP or other resources, another safety net.
We would love to do that. The issue is we don't know whether we have the universe of UI participants, but we don't have linked data to their births. We only have birth information among TANF and SNAP recipients. But what we're looking to do in a subsequent study, which was suggested by a colleague, I think is a great idea, is we can link those data to Department of Education information. And so if we have the universe of children who are participating in kindergarten, in public kindergarten, we can link them to their parents' unemployment insurance and go back. And so then we can assume their birth date, or we have their birth date from ed records. It would just be 5 years before kindergarten. So it's like a backdoor way of getting at, and then we can focus on low wage workers in particular and what they did in the year before, the year after births. Because yes, we're missing a lot of low wage workers who don't participate in the safety net for whatever reason.
In your SNAP records, do you know if they had SSI income? Would that be part of their certification for SNAP?
It might be. I don't know that.
It probably wouldn't affect your employed sample, but your unemployed sample could be an SSI. And then if the child's born with any kind of disability, then the child could be receiving SSI.
Yeah.
That's just a huge, it's going to blow away any of these benefit levels. So.
Good point. Yeah, it'd be good to know at least what proportion.
It might be relatively high given its population.
Are they going to get an SSI that fast?
Yeah, if the kid's born,
Is the kids one?
yeah,
Oh, the kids.
they'll enroll in the hospital. It's a developmental issue.
No, but probably during pregnancy, it wouldn't necessarily.
No, unless the parent, the mom already has it.
Yeah.
So I, 2 comments, a brief one and then maybe a longer one. In some states, including Wisconsin, another way to define the population is Medicaid covered births. And if you could link that to all your other records, like the good folks at IRP have done, then you maybe have the broader sample. And then maybe more to what you showed today. I wondered about the paid family medical leave stuff and how relevant that is for your sample. Like I think of paid leave as especially valuable for higher income mothers, both because the leave is more valuable and they're more likely to work for someone who offers it. But maybe you could do some simulations, like for this sample, if they'd had paid leave, like who do you think would have been able to get it and how much income would it have replaced?
Yeah, like New York program or something. Yeah, I think it's a great point, and you're right. Certainly, employer paid family leave is disproportionately accessible, but also benefits higher income workers. Public paid family leave is pretty effective in expanding access and use among lower wage workers too. It's certainly not perfect, and a lot of people don't pick it up, whether it's awareness or they still can't afford 95% wage replacement, or their employers are not good actors. But yeah, it's a good point, and good idea about the simulation.
There's a hand over.
Oh, sorry. I didn't get on the screen. 2 questions about things I don't know about that I think are relevant here. So one is the 80% EITC take up. Don't think I've ever seen it broken down about how much that's actually parents versus adults without children who would be getting a really low benefit level who are not probably filing taxes in the first place. And or parents who are at the very lowest end of the earnings phase in, and so they would be getting hardly anything. So I don't know if there's work that shows us who is not taking up the EITC, but my hunch would be the people who can get a lot of benefits are filing. And so it's probably not as far off, like you're not as over optimistic with that. And then the other thing that I don't know about is how we should think about SNAP household rosters as a proxy for household membership. Because people can choose who to be in a SNAP unit with, and the SNAP unit doesn't have to match who's in their housing unit with them. And I just don't know how often people choose to file with everyone in their housing unit versus choose to file with a subset of people in their housing unit.
You can try to get more information on how it works in Virginia too. Is that true in TANF as well? TANF again is a smaller.
Nobody's doing TANF, so I don't know. But like SNAP, if you had a mom and her 2 kids living with her mother and some of her siblings, they could all go in together as a SNAP unit, or they can file separately as 2 SNAP units. And so the household membership is the same, and you are getting to observe them or not observe them, depending on what they claim.
Yeah, I wonder if we can address this comparing rosters and addresses. We don't have, but we could ask for some crosswalk or something.
I don't know if anyone has done research on how SNAP net claiming matches up with household membership.
I don't know of any.
Jim? And the reference you want for the ITC is Maggie Jones and Jim Ziliak, 20 National Tax Journal Musgrave Prize winner. Because they used administrative records inside the Census Bureau, and they can tell you who was more likely to not take up the ITC. That's the classic.
Thank you. I will look to that because it is a great point. I would assume it operates somewhat like SNAP, whereas household with children is more likely to file taxes and apply. I don't even know about filing taxes. I assume there's variation by different characteristics, but I haven't seen this. But I'll look at that and other work too. Thank you.
I was wondering about the fungible point, which I think is really important because our safety net is so obsessed with in-kind benefits. Do you have a sense about what percent of expenses or income is spent on food in these households? And that might help to make that point stronger. And then I guess kind of on a related point, the graphs that you're showing right now are just about total resources and total income. But as you kind of keep pointing out, expenses are also going up. And so if there's any way to demonstrate that more formally, I think that would be really valuable.
Yeah, we've talked about doing kind of an adjusted income to needs ratio. And a graph like I showed at the beginning with Alex Steinzik's work, different measures of income and expenses. Because yeah, it's this, even if resources are offset, you still got a whole different need at 12 months later. Yeah,
like if you did like a supplemental poverty measure.
That's what I was saying.
Yes, yeah.
If you did it all relative to that, then you would show a better. That would also allow for your geographical variation.
Good point. Yeah. Yeah, that's really good point.
And then you're getting away from these dollar-to-dollar measures, which aren't quite right.
That's great. And anchoring on something kind of meaningful. Great points. Thank you.
The family medical leave thing that Dan mentioned, do you have how many different employers? And that's important, right? If you, in that employment data, if you have people switching from job to job, they may not qualify because of so much switching or not enough hours for family medical leave under New York or whoever's rules are there. There's a lot of job instability. And the other thing is, my guess is based on Catherine Magnus. I wrote a paper we never published. Her dissertation was on 63 mothers with first births and from fragile families, and not one of them paid rent in the first. Not one of them paid rent in the first 6 months after birth. They were all living with somebody else and weren't paying rent. That makes a big difference to the household. You still need to eat, but rent-free. That was the biggest transfer by far that these mothers got.
That's really interesting.
I don't know if you can get at that with this data, but
we can't, but I think it's important context. We can get at number of jobs. So we could approximate FMLA eligibility, at least job protection eligibility. From job switching, we only have earnings. We don't know hours, so we couldn't get at that eligibility parameter. But that's a great idea. And a lot of these women are working multiple jobs too when they're working.
I have no idea what that does to paid family leave eligibility. Job instability certainly is not good for anything from an employer under any circumstances. Public.
This is really great feedback. I really appreciate it.
Maybe a year's worth of work to 2 years. You need to decide what's important.
Well, I mean, like the Wisconsin administrative data, you could answer so many questions. And then there's also questions that you're like, oh, I'm going to answer that question and you can't, given some sort of constraint or lack of control group or what have you. But, or that it's one state. So when a statewide policy changes, it's a little trickier. But administrative data, it's been a wealth of, it's been a learning experience for me, that's for sure.
Not seeing any more questions. We will thank Taryn for the